The minutes and hours immediately following mushroom consumption can determine survival outcomes, and bystanders often find themselves in positions where their actions or inactions directly affect whether someone lives or dies. Understanding appropriate first aid for suspected mushroom poisoning isn't just useful knowledge for foragers, it's potentially life-saving information for anyone who might encounter a poisoning situation, from family members to hiking companions to restaurant staff. The absolute first priority is calling emergency services immediately, not waiting to see if symptoms develop or worsen. Not trying home remedies first. Immediate contact with emergency medical services and poison control centers. This urgency reflects the critical importance of early intervention for many mushroom toxins, particularly amatoxins, where every hour of delay before treatment reduces survival chances. The 911 dispatcher needs clear information: suspected mushroom poisoning, what was consumed and approximately how much, when consumption occurred, and current symptoms even if they seem mild. Preserving mushroom samples for identification ranks as the second critical action. If any of the mushrooms that were consumed remain, collect them carefully without contaminating evidence. Place samples in paper bags rather than plastic, which traps moisture and accelerates decomposition. If the mushrooms were cooked, save any remnants from the meal. Even photographs of the mushrooms before consumption provide valuable information for mycologists and poison control centers trying to identify species and predict toxin syndrome. This identification directly determines treatment protocols and prognosis. For symptomatic patients, basic supportive care focuses on preventing complications while waiting for paramedics. If the person is vomiting, position them to prevent aspiration on their side if lying down, leaning forward if sitting. Don't induce vomiting unless explicitly instructed by poison control. In many poisoning scenarios, inducing vomiting does more harm than good, and only professionals can determine when it's appropriate. Monitor consciousness level and breathing continuously. If the person becomes unresponsive or stops breathing normally, CPR may be necessary while waiting for emergency services. Preparing information for paramedics improves handoff efficiency and ensures critical details aren't lost. Know exactly what was eaten and when, measured in hours before the emergency call. Have the patient's weight available if possible. Toxin doses scale with body weight, making this medically relevant. Document the symptoms timeline: when symptoms started, how they've progressed, what the person is experiencing now. This temporal information helps medical professionals predict which toxin syndrome they're dealing with and adjust treatment accordingly. Understanding what not to do is equally important as knowing appropriate actions. Don't give milk or any other substances based on folk beliefs about neutralizing toxins. These interventions lack scientific support and waste precious time. Don't wait for symptoms to develop before seeking help if someone consumed wild mushrooms of uncertain identity. The latency period for amatoxin poisoning means by the time severe symptoms appear, irreversible damage has occurred. Don't attempt home remedies or alternative medicine approaches. Mushroom poisoning requires professional medical management. And don't minimize the situation or assume everything will be fine. Mushroom poisoning can progress from seeming mild to life-threatening rapidly. Poison Control Center information should be readily available. In the United States, the number is 1-800-222-1222. This connects to regional poison control centers with toxicology experts who can provide immediate guidance while the ambulance is en route. They can coordinate with receiving hospitals to ensure appropriate treatment protocols are ready when the patient arrives. Early poison control involvement improves outcomes by ensuring medical teams understand they're dealing with potential mushroom poisoning rather than discovering this after valuable intervention time has passed. Time-stamped case studies demonstrate how actions in the first 30 minutes affect survival. In cases where bystanders immediately called emergency services, preserved mushroom samples for identification, and provided accurate consumption timeline information, patients received appropriate early treatment and survival rates improved. Contrast this with cases where delays occurred because people waited to see if it got worse or tried home remedies first. The hours lost to these delays meant arriving at hospitals after the window for preventing toxin absorption had closed, leading to worse outcomes despite identical subsequent medical care.